Hello, I'm Dr. Charles Wallace from Dallas, Texas. I'd like to welcome you to my website. We'll be able to answer a lot of your questions about plastic surgery here, and we look forward to meeting you in person to answer any others that you may have. I'm one of those people who really has been quite lucky in my life. And my luck really started when I was very young, and my grandmother told me that I needed to go to medical school. Now, I'm not really sure exactly why she said that, but at any rate, I decided that I probably should listen to her and ended up going to medical school, and at the time I thought I was going to be an orthopedic surgeon. Growing up doing the things that I did, that was about the only sort of doctor that I knew anything about, and so it seemed like a natural fit. I really went through medical school thinking that, but as I got into my surgical internship, I encountered a plastic surgeon by the name of Dr. Don Parsa, who's a dear friend of mine to this day. And watching the reconstruction of the face after accidents and the delicate reworking of the bones and so on that's associated with those types of operations, it diverted my attention from orthopedics. I think of myself as being one who's a problem solver. And because of the variety of problems that plastic surgery as a specialty deals with, if you can't solve problems well, then you're not likely to be a very good plastic surgeon. And that's what I feel like I do. I find the tools, the combinations of operations, the precise techniques, the new gadgets and gizmos that really work, and the old procedures and gadgets and gizmos that are still good, and adapt those to whatever the problem is at hand. People are always asking just exactly what plastic surgery is. And plastic surgery is sort of unique in medicine in that it's the one specialty that's really not defined by the study and attention to a particular organ system or a particular body part. We don't really have anatomic boundaries in plastic surgery. Rather, it's problem solving of all sorts of circumstances, from birth defects and burns, cancer and trauma reconstructions, and of course what gets the most headlines these days is cosmetic surgery. Cosmetic surgery is an outgrowth of the perfection of techniques that took place from wartime injuries, trauma injuries, and cancer victims. And as those reconstructive techniques were perfected and improved upon, they became reliable enough to be offered on an elective basis. The fact is, there's many good plastic surgeons, both in Dallas and Texas. We're really blessed to have a very good group of colleagues. What you have to find is the doctor where you feel comfortable both with the doctor and with the office. Your experience as a plastic surgery patient will be one of coming in for consultations, having an operation or treatments, and then the care down the line. And not just the doctor, but the nurses, the reception people, the technicians in the office, all of that goes together to form your plastic surgery experience. And it varies. I mean, just like the doctor's skill and experience and personalities vary, so too do the personalities and feel of different people's offices. And finding someplace where you feel comfortable and where you fit in, that has a lot to do with your plastic surgery experience. I'm the quarterback on a team, and I can't do it all. I have to have good help. And that's something that I pride myself in, is having assembled a very good team. Several of my people have been with me almost 15 years, a couple of others over 10 years, and that's the kind of experience that one brings to bear in my office. Some of the things that people ask me about seem like simple questions, like do you put your breast implant under the muscle or on top of the muscle? Or do you use an armpit incision or a nipple incision or a crease incision? And the fact is, we use all of those incisions and all of those approaches because no key fits every lock. The breast of each patient is an individual matter, and while there's patterns, certainly there are patterns, we can't put all the implants under the muscle, we can't put all the incisions in the armpit, even though that's the way we do most of them for the person who's never had implants and who does not have sag troubles. That has the obvious advantage of no scar on the breast, but no one approach, whether it's in breast augmentation, nasal surgery, facelift operations, or for that matter liposuction, no one approach is right for every patient. Because there are so many techniques that are available for even seemingly simple operations like breast augmentation and liposuction, sorting out what exactly is the best technique for a given individual is something that comes down to a person's training and experience. Having the benefit of thousands of these operations and many years of experience leads me to be able to sort out what's best for a given individual's wishes and circumstances. The discussion of plastic surgery costs is obviously an important part of one's doctor choosing and decision-making process. This is something that sometimes difficult to discuss. However, it is something that we feel that we offer a great cost-to-value ratio. We're not the cheapest plastic surgery clinic in the city, and we frankly don't want to be. By a long shot, however, we're also not the most expensive. One value that we offer to you is that we have a fully certified surgery center in our building that we control. This gives us ease of scheduling, control over staffing, and we have plastic surgery professionals that are nurses, anesthetists, our surgery technicians who are all skilled specifically at plastic surgery procedures. I understand that making the decision to have plastic surgery can be a difficult one. For some people it might be frightening, for others it may just be confusing or difficult. We offer a number of different ways to schedule consultations and get the questions that you have answered in an individual fashion that will enable you to make an informed decision.